Let's talk more about depression. Mood depression. Depression is a state of low mood and aversion to activity that can affect a person's thoughts, behavior, feelings, and sense of well being. Depressed people can feel sad, anxious, empty, hopeless, worried, helpless, worthless, guilty, alone, irritable, hurt, or restless. They may lose interest in activities that were once pleasurable, experience loss of appetite, or overeating. Having problems concentrating, remembering details, or making decisions, and may contemplate, attempt, or commit suicide. Insomnia, excessive sleeping, fatigue, aches, pains, digestive problems, or reduced energy may also be present. Depressed mood is not always a psychiatric disorder. It may be a normal reaction to certain life events, a symptom of some medical conditions, or a side effect of some drugs or medical treatments. Depressed mood is also a primary or associated feature of certain psychiatric syndromes, such as clinical depression. Causes: life events. Adversity in childhood, such as bereavement, neglect, unequal parental treatment of siblings, physical abuse, or sexual abuse, significantly increases the likelihood of experiencing depression over the life course. Life events and changes that may precipitate depressed mood include childbirth, menopause, financial difficulties, job problems, a medical diagnosis, bullying, loss of a loved one, natural disasters, social isolation, relationship troubles, jealousy, separation, and catastrophic injury. Medical treatments. Certain medications are known to cause depressed mood in a significant number of patients. These include interferon therapy for hepatitis C. Non-psychiatric illnesses. Depressed mood can be the result of a number of infectious diseases, nutritional deficiencies, neurological conditions, and physiological problems including hypoandrogenism in men, Addison's disease, Lyme disease, multiple sclerosis, chronic pain, stroke, diabetes, cancer, sleep apnea, and disturbed circadian rhythm. It is often one of the early symptoms of hypothyroidism, reduced activity of the thyroid gland. Psychiatric syndromes. A number of psychiatric syndromes feature depressed mood as a main symptom. The mood disorders are a group of disorders considered to be primary disturbances of mood. These include major depressive disorder, commonly called major depression or clinical depression, where a person has at least 2 weeks of depressed mood or a loss of interest or pleasure in nearly all activities. And dysthymia, a state of chronic depressed mood, the symptoms of which do not meet the severity of a major depressive episode. Another mood disorder, bipolar disorder, features one or more episodes of abnormally elevated mood, cognition, and energy levels, but may also involve one or more depressive episodes. When the course of depressive episodes follows a seasonal pattern, the disorder, major depressive disorder, bipolar disorder, etc., may be described as seasonal affective disorder. Outside the mood disorders, borderline personality disorder commonly features depressed mood. Adjustment disorder with depressed mood is a mood disturbance appearing as a psychological response to an identifiable event or stressor in which the resulting emotional or behavioral symptoms are significant but do not meet the criteria for a major depressive episode. And post-traumatic stress disorder, an anxiety disorder that sometimes follows trauma, is commonly accompanied by depressed mood. Drug use. Depression is associated with abusive drug use. Treatment. Depressed mood may not require any professional treatment and may be a normal reaction to certain life events, a symptom of some medical conditions, or a side effect of some drug or medical treatments. A prolonged depressed mood, especially in combination with other symptoms, may lead to a diagnosis of psychiatric or medical condition which may benefit from treatment. Different subdivisions of depression have different treatment approaches. Given an accurate diagnosis of major depressive disorder, in general, the type of treatment, psychotherapy and/or antidepressants, alternative therapies, or active intervention is less important than getting depressed patients involved in an active therapeutic program. Moderate levels of physical activity can treat depression by increasing the levels of endorphins and the neurotransmitters serotonin, dopamine, and adrenaline. Exercise allows individuals to improve their health while building new relationships with others and bolstering the sense of community that comes with exercising as a group. Group activities can lower depression by increasing depressed individuals' ability to interact with others. Exercise also increases individual self-confidence by promoting social skills that people with depression often lack and interrupts the cycle of isolation from the general population that can further increase depression. Exercise fosters non-demanding behaviors while allowing people to socialize and identify themselves as part of the general population. Lifestyle strategies that may improve depressed mood include wake therapy, light therapy, eating a healthy diet, meditation, exercise, and smoking cessation. You can also read about sadness, melancholia, upset, feeling, depression, mood, depression.